Hello everyone. So I'm back with part 2 of our topic of discussion, that was calcium deficiency and its related disorder. So today we will going to discuss about the pathophysiology of rickets and osteomalacia. What is the actual difference between rickets and osteomalacia? So let's get started. Now, the cause of the faulty process of bone mineralization is due to deficient or impaired metabolism of vitamin D or phosphate or calcium. We all know that. And the consequence is either it is rickets in children or osteomalacia in adults. So rickets in children and osteomalacia in adults. Now we will discuss a little bit of anatomy which is relevant in this topic. So we all know the anatomy of long bone such as femur. So I have drawn a picture here. Here the ends of the long bone such as femur are called here in this region. This region is called epiphysis and the shaft is called diaphysis. In between this diaphysis and epiphysis, two regions there, these regions are called metaphysis. And these metaphyses contains few plates. Here few plates are there in metaphyseal region and these plates are called metaphyseal plates or growth plates. Now what happens when the bone stops growing? These metaphyseal plates are replaced by fine lines. Metaphyseal plates are replaced by lines. So this is called metaphyseal closure. So what's the relevance of this anatomy with this rickets and osteomalacia? Now we will going to discuss that. Before discussing that, I would like to say about bone mineralization. So there is a question, what is bone mineralization? So we all know that there are some specialized cells in the bone. Those are called osteoblasts. Specialized cells of the bone are called osteoblasts. They actually help in building bone. Okay. So these osteoblast cells, they secrete some kind of organic material that is called osteoids. So osteoblast cells secrete some organic material. These are called osteoids. These osteoids are made up of type 1 collagens. Okay. Now what happens next? These osteoblast cells, they just drag calcium and phosphates from the bloodstream to this framework made up of osteoids. And all the calcium and phosphates are stored in the matrix or framework of the bone. Okay, this process is called bone mineralization. Okay, so bone mineralization actually strengthens the bone. It causes strengthening of bone. There is an enzyme that is called alkaline phosphatase. This alkaline phosphatase enzyme actually, it has an important role in bone mineralization. And the activity of alkaline phosphatase is dependent upon these osteoblast cells. So we have discussed this process in a very brief manner. Now, I would like to tell you some important points about osteomalacia and rickets. What is the basic difference between these two diseases? Okay, so rickets is a disorder. Rickets is a disorder of impaired mineralization of cartilaginous growth plates.